Hello, I'm Dr. Ron Balkasoon. I'm a pulmonologist and contract consultant in Denver. I work at National Jewish Health in Denver, Colorado, and I'm a paid speaker for Sunovion Pharmaceuticals. Thank you for joining me for today's presentation, Understanding COPD and Its Consequences, a look at COPD's widespread impact and clinical guidelines. This promotional non-CME program, presented on behalf of Sunovion Pharmaceuticals, is intended only for U.S. healthcare professionals involved in the treatment of patients with COPD. The information contained herein is intended for general information purposes only, and it's not a substitute for your professional medical advice and judgment. Official COPD definition from Gold. Chronic obstructive pulmonary disease, COPD, is a common, preventable, and treatable disease that is characterized by persistent respiratory symptoms and airflow limitation that is due to airway and/or alveolar abnormalities, usually caused by significant exposures to noxious particles or gases. Please note that Gold does not endorse any specific treatments. We'll start by defining COPD, which stands for chronic obstructive pulmonary disease. COPD is a condition that makes it difficult to get air out of the lungs, and it is often accompanied by some degree of hyperinflation of the lungs. This can lead to shortness of breath even when doing everyday activities such as climbing steps. While there's no cure for COPD, it is a disease that can be managed. As you are aware, COPD is a progressive and chronic disease that affects millions of people worldwide. COPD affects approximately 24 million people. However, the disease remains underdiagnosed, with only 12.7 million people receiving an official diagnosis. Women have higher rates of COPD throughout most of their lifespan, and it appears that they are especially vulnerable before the age of 65. For patients with COPD and their caregivers, COPD presents a burden. COPD is the third leading cause of death in the United States, and in 2009, 133,965 people died of COPD, and more than half of these deaths occurred in women. No COPD products have been shown to have an impact on mortality. Let's take a look at the causes of COPD. COPD can be caused by cigarette smoking. In the United States, cigarette smoking accounts for 90% of COPD cases, making it the primary cause of COPD. Environmental irritants are an additional cause of COPD. Inhaling fire smoke, dust, or certain types of chemical fumes over a long period of time can cause COPD. And genetics also play a role in COPD onset. Some people inherit genes that put them at a higher risk for getting COPD. Alpha-1 antitrypsin deficiency, alpha-1, is a genetic condition present in approximately 100,000 people in the United States. And people with alpha-1 lung disease, often referred to as genetic COPD, possess two abnormal genes. So now we'll take a look at the common symptoms of COPD. 4 key symptoms of COPD include wheezing and chest tightness, persistent, difficult, or labored breathing that worsens with exercise and over time, chronic productive cough, and chronic sputum production. Exacerbations are a manifestation of COPD, and they're defined by episodic worsened lung function, and they're caused by colds, influenza, or infections which can be bacterial, viral, or both. They're often triggered by inhaled environmental irritants and pollution. Reevaluate lung function after an exacerbation. COPD exacerbations are not random events, and COPD exacerbations often cluster together in time and are more likely among patients with a history of exacerbations. In a clinical trial, approximately 27% of initial exacerbations were followed by a second exacerbation in the following 8 weeks. In a separate clinical trial, it was determined that patients with a history of exacerbations are at higher risk for future exacerbations. The likelihood of an event was nearly 6 times higher in patients with greater than or equal to 2 exacerbations in the previous year versus patients with no exacerbations. In many patients, lung function does not always return to baseline. And in some cases in this clinical trial, lung function did not return to baseline even 3 months after an initial exacerbation. Recovery was incomplete in a significant number of COPD patients. COPD can be confirmed only through spirometry, and spirometry should be measured the forced vital capacity, FVC, and forced expiratory volume in 1 second, FEV1. Then the ratio of these two measurements, FEV1, FVC ratio, should be calculated. Spirometry measures are evaluated by comparison of the results with appropriate reference values based on age, height, sex, and race. Patients undergoing a spirometry test should exert their maximal effort to avoid underestimation of values and the diagnosis and management errors that could occur as a result. According to GOLD, spirometry is a non-invasive and readily available test. Good quality spirometric measurements is possible in any healthcare setting, and all healthcare workers who care for COPD patients should have access to spirometry. And this is from GOLD 2017. Post-bronchodilation spirometry is required to make a diagnosis. An FEV1-FVC ratio of less than 70% confirms persistent airflow limitation, and please note that GOLD does not endorse any specific treatments. The economic burden of COPD is substantial and projected to increase. In fact, total national medical costs attributable to COPD and its consequences are expected to rise from an estimated $32.1 billion in 2010 to $49 billion by 2025. In contrast to other chronic diseases, the hospitalization rate for COPD has increased. Over the last decade, a number of diseases, including cardiovascular disorders, pneumonia, and lung cancer, have shown a reduction in hospital admissions, but COPD has not. This increase has contributed to significant inpatient hospitalization costs. As a result of the increasing economic costs of COPD, there has been an increased focus on healthcare outcomes. In 2015, COPD was added as one of the top 5 reasons for hospital readmission by the Centers for Medicare and Medicaid Services Hospital Readmissions Reduction Program. Medicare reimbursement penalties of up to 3% are allowed for COPD 30-day readmissions. No COPD treatments have been shown to reduce the economic impact of the disease. The key updates to the 2017 GOLD report to note the clinical practice include the following. Spirometry is necessary for confirming the diagnosis, but no longer needed for grouping A, B, C, or D, or determining pharmacotherapy. Bronchodilators are central to COPD management and should be given on a regular basis to prevent or reduce symptoms. Long-acting bronchodilators are preferred over short-acting bronchodilators as maintenance therapy, except for patients with only occasional dyspnea. Use of short-acting bronchodilators on a regular basis is generally not recommended. The importance of proper inhaler technique cannot be overemphasized and should be rechecked at each visit. And the selection of inhaler device depends on the patient's ability and preference. Therapy should be escalated or de-escalated based on symptoms and exacerbations. And please note that GOLD does not endorse any specific treatments. This table further clarifies the initial pharmacologic management of COPD by patient group as recommended by GOLD. GOLD's first choice recommendations are as follows. For Group A patients, it's recommended to take either a short-acting or long-acting bronchodilator. For Group B patients, it's recommended to take a single long-acting bronchodilator, either a LABA or a LAMA. For Group C patients, it's recommended to take a single long-acting bronchodilator, and a LAMA is recommended. And for Group D patients, it's recommended to take a LABA-LAMA combination. And please note, GOLD does not endorse any specific treatments. In addition, GOLD recommends bronchodilators for stable COPD. Bronchodilator medications are central to COPD symptom management. Inhaled therapy is preferred. And bronchodilators are central to COPD management. Long-acting bronchodilators are preferred over short-acting bronchodilators as maintenance therapy. Please note, GOLD does not endorse any specific treatments. This concludes our discussion of COPD and its impact. Thank you very much for your time.